we're developing the first approach to spinal cord injury that protects and guides the body's own tissue to help recovery, functional recovery, and avoid long-term injury. Spinal cord injury is a devastating illness with no cure. There are about 700,000 cases worldwide every year, 17,000 cases in the US, and the cost for the patient is very high. Most of the two-thirds of the two-thirds of the injuries are caused by accidents or falls, the rest by sports accidents or other causes. When you have an injury, the patient is directed to a trauma hospital that has a spinal cord injury specialty. So the trauma neurosurgeons at the hospital would be our first proponents for the treatment. You have the payers after FDA clinical trial approval. That would be regular medical insurance, Medicare, Veterans Administration. And the biggest component that you can save the cost is related to hospitalization and rehab. So reducing those costs are the benefits to the buyers. The treatment cost is projected at $200,000, which is a credible number based on information from the Reeve Foundation, medical device experts, and legal settlements. So just for acute spinal cord injury, the market is about $500 million every year in the US. This would be 14% of the 17,000 patients, so about 2,400. The worldwide market is more like 4.4 billion, that would be 5%. And again, it's only for acute spinal cord injury. There are large additional markets for chronic spinal cord injury, so it's likely we can do this too. Peripheral nerve injuries, the market is a little bit bigger, and the veterinary use. Our key innovation is that we can guide neuronal growth with an injectable scaffold that perfectly conforms to any shape of an injury site. It provides guidance for neurons, and it's fast and minimally invasive. So we have an issued patent and several other pending patent applications for the technology. Dr. Parr's technology at the University of Minnesota, her key innovation is that she can accelerate the differentiation of stem cells. So stem cells are a very promising approach for spinal cord injury, but also for other ones. It was just yesterday where they did an eye transplant, and they hope to actually regenerate vision by an eye transplant. So she can turn skin cells of a patient into spinal neural stem cells. So this process here, you take a small biopsy, and you differentiate them, amplify them, and then you can inject them into the same person, which means there will be no rejection. If you have other stem cells, other patient cells, there could be rejection. So this means they can be co-injected with our injectable scaffold in a combination therapy that would be universal and ready for the patient when the patient is ready for that intervention. So the way this works, you have this injury here that could be a complete cut or a crush filled with blood or other fluid. The neurosurgeon would carefully remove something of the blood, and then you fill it with the combination of the magnetic particles and the spinal neural stem cells. You then apply a magnetic field. This is like, we call this a magnetic mouse. It has magnets on the side. You put it on top of the cord, and within minutes, you create these magnetically formed fibers. That's exactly the same thing as when you played in elementary school with iron filings on a piece of paper, and you put a magnet underneath. They follow the field lines. This is exactly the same approach, only like 100 times smaller. And I was at a conference where people have tried to make injectable scaffolds where they already have fibers aligned. But that doesn't really work, because it's like being in here with a 30-foot ladder, and you can't really turn it in a crowded space. The spinal cord is difficult, it's viscous, and you can't really arrange it. So I thought, wait a minute, I've worked with magnetic particles for a long time, and if you inject the particles, they can actually diffuse and go in every little nook and cranny that you have, and then you apply the field and you create the fibers. They get cross-linked, biodegradable DNA from the person. You can use a buccal swab of the person's own DNA, cross-link the fibers, and then after a few minutes, 5 minutes, you can take the magnet away, and the fibers remain like this. This is the device that I just showed. It's very simple. It has 2 rows of magnets here with the window in the middle, and you would then place it after the stabilization, whenever you're ready with the patient, to, after the injection, to align the fibers and create the fibers in the center. On the left, you can see a microscopic image. Jason Pocalla from Princeton was here too. You can see individual neuroids from several axons, neurons that grow along these fibers. Here, this is an explant, so a part of a spinal cord from a pig, roughly the same size of a human. And you can see here, if you have an irregular shaped injury, the fibers completely, perfectly bind and connect with the outside. And so establishing this molecular contact is really important to have a graft-host interaction. So scaffolds that have been used by now by other companies, they're basically blunt cylinders or something like this. You have to cut the spinal cord and then you put them in, and even then, it's not a good connection to most of the remaining axons on the other end. So with our injectable scaffold, it's not only simpler, but it creates much better contact for the neurons then to talk to each other.